So, for my research proposal, I am doing mine on the topic of dietary interventions and physical activity for weight loss compared to GLP-1 agonists. So, my research question is in adults who meet clinical requirements to be prescribed GLP-1 agonists for weight loss, what is the effect of semaglutide and tirzepatide on weight loss and maintenance compared to standard therapy of a healthy diet and physical activity regimen within 6 months of adherence? And then to the right, I just have some pictures of the typical Ozempic semaglutide that you see on the market right now. So just to introduce this topic a little bit, the obesity epidemic is a growing problem in the United States, and also now it's in many other countries, but it can be attributed to many factors, which could be time, economic limitations, physical activity levels, and also access to healthy food. So it is at an all-time high of 41.9% of adults in the US. About 50% of Americans aged 18 or older meet the federal physical activity guidelines, which is not really good at all. So 46.9% of adults meet aerobic activity guidelines, while only 24.2% of adults meet both the aerobic and the muscle strengthening activity guidelines. This is also a time when, or also the first time, when the national rate of obesity has past 40%. So this is now a public health crisis that affects all genders, ages, and ethnicities. So also with it not being limited to the US, the rates have been increasing around the world. So we've seen the adult obesity amount increase to 2.5 billion adults overweight, and 890 million of these adults were living with obesity. Just speaking of some more barriers to healthy eating, so 54% of Americans report not understanding how to read a nutrition label. About 25% say that they do not have time to prepare healthy meals, and then about 20% say that they do not know how to cook healthy food. So this is what we're looking at as, potential factors of why the obesity rates are so high. So also the government is trying to take a more active role in intervention and prevention policies to combat this epidemic. So they have grant-based food subsidy programs. They also have introduced school-based nutrition programs as well. But despite all these efforts taken to combat this epidemic, there's still very high rates of obesity. So that's why the GLP-1 agonists have now been introduced as a class of medication that could be used for weight management. It was originally introduced for diabetes control, type 2. So now they've allowed it to be extended to those who are looking to lose weight as well. So here's just a little visual of the map of the US and then the obesity rates in 2023. So luckily we have yet to see 50% or higher, but we're really getting close to that. But you see that your highest states with the dark red will be Oklahoma, Louisiana, and West Virginia. And then you see a good majority follows behind, like Texas, South Dakota, Kansas, Ohio, Georgia, South Carolina, Alabama. All those states still have really high rates of obesity, even, when you look at the orange. So most of the whole US is in orange to red, which is very high. And you only see a few places that are even have a quarter, of their population with obesity. So this is a huge concern at this point. So just looking at the literature review, so there's a couple different, opposing sides, like some people are for it, some people are against it, but this is kind of what I saw overall. So GLP-1 agonists used in conjunction with diet and lifestyle changes is especially useful for those with type 2 diabetes, which it was originally made for those with type 2 diabetes. So it's easy to see that they are able to lose the weight when they have that assistance. So when it was made for the type 2 diabetes population, what the medicine did is it would stimulate the release of insulin and suppress the glucagon secretion only when the blood sugar concentrations were elevated. And then they were able to reduce their HbA1c by about 1% to get them closer to normal ranges. So when they use the GLP-1 agonist with a lifestyle change, they really see great results. And then some more of the literature says that to achieve meaningful weight loss of 5% or more, programs must be delivered by trained interventionists and provide instruction and behavioral principles to modify dietary intake and physical activity levels for 6 months. So that's what most of the data is saying, that it needs to be a long-term educational experience. It can't be 12 weeks. It needs to be, a long-term sustainable intervention for them. Within this literature that I was able to see, so they talk about a multi-component behavioral intervention. So this includes diet, physical activity, and behavior therapy. And so for diet, they don't suggest one specific diet. It's either, it's picking one that they can sustain. That's the key. So whether it's a Mediterranean or a low carb, high protein diet or a low glycemic low diet, whatever that person can maintain long term is what they want them to follow. So they're not pushing any one single diet to follow while taking, any of the GLP-1 agonists. And then physical activity, so 150 to 180 minutes of moderately vigorous aerobic activity. So this could be brisk walking or even cycling. And then for the behavioral therapy, what they do is they provide tools to facilitate change in eating and physical activity patterns. This can be done through goal setting, self-monitoring of food and calorie intake, using cognitive techniques to address maladaptive thinking, and many more. And then they want them to participate in the high intensity programs that provides 14 or more counseling sessions with a trained interventionist. And these are face-to-face individual treatment. So that's a good way for, people who want to lose weight. If they adhere to 6 months of this kind of program, they can actually sustain that weight loss without the GLP-1 agonist though. And then the third literature that I was able to see was that the GI adverse events are very common with GLP-1 agonist use. So 40 to 70% of people using these medications do have, nausea, diarrhea, vomiting, those sort of side effects, but also it can get even more serious and go into gastroparesis and pancreatitis. So gastroparesis is where the stomach is practically paralyzed. It leads to malnutrition and, nutrients aren't getting delivered where they need to go. And then pancreatitis is the body's inability to process fats and foods, again, leading to malnutrition. So it's like this double-edged sword. So they are overweight and they're looking to lose weight. And then maybe the medication causes the gastroparesis or the pancreatitis, and now they're no longer able to even hold on to weight. So they're malnourished. So it's the very opposite ends of the spectrum, and either one is not good to be at long-term. So the methodology for my design is going to be an experimental design, and it's a controlled trial. So I'm going to have certain participants taking lifestyle and diet changes, and then a certain number of participants taking the GLP-1 agonists just to see which one. And then for the data collection, I'll do a pre-interview questionnaire and a post-interview questionnaire so I can get a better idea of the behavioral habits with these people who are trying to lose the weight and having difficulties. And then I'll look at biochemical markers, anthropometric measurements, and then also they will turn in once weekly chronometer reports of their diet, and they can pick any day, and it's encouraged to, pick different days, even regardless of if they ate healthy that day or not, just so I can see what changes are being implemented and maintained throughout the 6-month experiment. And then for the population, I'll be looking at existing patients of the Millennium Physician Group of Florida and the Southwest region. They have to meet the clinical requirements to be prescribed the GLP-1 agonist. So here's an example of the pre and post questionnaire. This is just from another group of health researchers, but it would be something similar to this, where I could get an understanding of, the mindset behind the inability to lose weight. So number 2, have there been any circumstances or life events that have triggered weight gain for you? This way I can really have a full understanding of all of the participants. So the inclusion and exclusion criteria, inclusion will be existing patients of the Millennium Group. It'll be from Lake Placid, Florida to Tampa. And then they have to have the BMI of 30 or higher, or if they don't have 30 or higher, they can have a BMI of 27 or higher with a weight-related health condition. This could be, high cholesterol, for example. That would be one. So exclusion, so they cannot have used a GLP-1 agonist in the last month. If they have, they're not allowed to be on this. No use of interactive medications, and then no pregnant or breastfeeding women just because their nutrient needs are different. So some of the discussion strengths and limitations. So key strengths. So this experiment will analyze the behaviors that go into weight gain and loss. It's not just seeing if the GLP-1 agonist or the lifestyle change is more effective. It goes into the psychology behind how these people are having difficulties with, weight loss. And then it also will educate these participants on lifestyle changes for long-term weight loss. So we're not just experimenting and then looking at the data. We're going to provide all of our participants with the tools and the mindset and everything needed in order to keep the weight off long-term. And this topic is very important with the prevalence of these medications today. They're extremely popular all over, the US. So this is something that's needed. And then some limitations. The research is new within this topic. They did get released, these medications in 2014, but they recently in 2021 became extremely popular. So there's not a whole bunch of research on them yet. There's also very limited research on just GLP-1 agonist or, lifestyle change for weight loss. Most of them say to do them at the same time, but there's not one that compares one or the other. And then it only examines participants within the Southwest region of Florida. So we are limited to just this area, which doesn't give you a great overview of, different cultural and, eating habits of somebody in different areas of the US.